Welcome to our first video conference. I'd like to say hello. My name is Lori Dupreet Brown, and I am the director of the UW-Madison campus-wide 4W initiative. That stands for Women and Wellbeing in Wisconsin and the World. And I'd like to thank you for participating in this conference that we've entitled Resistance and Reimagination: Gender, Change, and the Arts. And we co-convene this conference with the UW System Women and Gender Studies Consortium. We have here Dr. Stephanie Ridolotti, who's the director of that consortium, Elizabeth Morris, Olivia Dahlquist, who's the team who have put together this amazing program. And now we're going to be, you're at the session that is hosted and shared by the African American Health Network, called, again, Resistance and Reimagination in the Health of African Americans, Programs and Poetry. And we're very proud that and honored that this group has every year put together an incredible panel for us. And I'm sure that this year will be no different. So before I introduce you to Dr. Eva Vivian, the panel moderator, I'd like to just give you a few instructions about how you can stay connected and speak to the conference. During the presentation, please feel free to pose questions for the presenters in the Q&A located at the bottom of your screen. And if you're having any tech issues, you can use the chat to write. One of our conference administrators will write back with help. There will also be closed captioning for this event by the Northwestern Court reporters. So please see the chat if you're interested in accessing that captioning. Today's session will be recorded and will be available in the future. So if you're a teacher or anyone who wants to use this, you'll be able to share these stories beyond. And thank you again for joining us. During the presentations, you'll notice that we're not stopping to answer your questions during the presentations. We want you to experience each small presentation, and we'll have the Q&A at the end, and the moderators will guide us through that. So our moderator for this session is Dr. Eva Vivian. Eva Marie Vivian is a professor at the University of Wisconsin-Madison School of Pharmacy. She received her Doctor of Pharmacy from the University of Illinois College of Pharmacy and a Master in Population Health Sciences at UW School of Medicine and Public Health. She also has a Doctorate of Philosophy from the University of Wisconsin School of Human Ecology. And she has been referred to as the researcher with a servant's heart because of her service to underserved communities in Madison. And she's the current president of the African American Health Network of Dane County. Their mission is to promote health education, healthy lifestyles, self-advocacy, empowerment, and well-being among African Americans in Dane County. She also serves on the board of directors of Access Community Health Centers, a local federally qualified health center, and she's a member of the Delta Sigma Theta sorority and the Metropolitan Madison chapter of Lynx. These are organizations that work tirelessly toward social justice. So we're very proud to welcome Eva and her panel to the conference. Eva, you might be muted.
Yes, thank you very much. And I am very honored to serve as the moderator this year for this session. I hope that you've had an opportunity to enjoy the conference. Many people ask me, what is the favorite part of my job? And I tell them, it's the opportunity to work with such incredible people in the community. And today I have the honor and privilege of introducing three incredibly wonderful women who have made great contributions to our community. And it is a pleasure and honor to be able to introduce them to you so that they can share some of the things that they currently engage in within the community. These women are members of the African American Health Network, and they have partnered with me with the UW Madison Community Academic Aging Research Network to actually review grant proposals from faculty to ensure that the research is culturally appropriate. And in addition to that, we're also going to be working with the community to offer education to address vaccine hesitancy and also make vaccinations accessible for those in underserved communities. And we recently received a grant from the Department of Health Services to support this effort. So it's my distinct pleasure to introduce our first speaker, Ms. Celestine Daniel, who is frequently referred to as Miss Charlie. Miss Charlie's contributions to the community over the last 40 years are too numerous to count. It would take an entire hour for me to really describe everything that she's been engaged in. But I can share with you that she is a true social warrior who works tirelessly to promote justice for marginalized groups. Now, in her retirement, she is the founder of the African American Opioid Coalition, a project of Safe Community Medicine of Dane County. She's also the director of Diversity and Inclusion for Falls Prevention. So without further ado, I'd like to present Ms. Charlie Daniel.
Thank you, my girlfriend, Eva, for that fine introduction. As she said, I am Miss Charlie Daniel in the community, and so happy to be here with you today for this conference. I started off being involved with women conferences over 20 years ago when the conference was held on the campus. So I'm very happy this year to be a presenter. I was a presenter in the past. Before I start my presentation, because we just finished with Women History Month, and this conference is for and about women, I would like to introduce you to the women who have influenced me in my life. So I would like to start off with a bridge. As you will see on this, a bridge of the Pettus Bridge in Selma, Alabama. Can we show that bridge, please? The Edmund Pettus Bridge is located in Selma, Alabama. As some of you might remember, this is the bridge where John Lewis passed over, where he was almost killed. And I don't want to say killed, because he was almost murdered. I think we should use the right terminology when we talk about things, when he was almost murdered on this bridge. So in order, and I will, as I go on with my presentation, you will find out why I decided to start off with the Edmund Pettus Bridge. I stood on the shoulders of Lily Pearl. Can we show Lily Pearl, please? Lily Pearl was my mother. As you can see, she was a snazzy dresser. I remember my mother being one of the most beautiful women that I had ever known, and I loved her dearly, and she loved me also. And Lily Pearl died at the age of 31 of breast cancer. So I didn't really get a chance to really know and enjoy my mother as I would have liked to. When my mother died, I we lived in Chicago. When my mother died, I went to live with my maternal grandmother, the person that influenced me most in my life, Elisha. As you can see, she was a snazzy woman herself. Elisha was the first feminist that I had ever met. She always told me I could be and do anything that I wanted to be as a little Negro girl being raised in Mississippi. By today's standard, Elisha would be the proprietor of a bed and breakfast. We lived across the tracks in a 4-bedroom house where the GMO train went through our neighborhood, and my grandmother would rent rooms to Black porters on the train And also, I'm proud to say that my grandmother also was a person who was raising 4 children by herself and decided to go into the liquor business, which was, of course, something that she wasn't supposed to do, but she did what she had to do to raise her 4 children. My grandmother, Elisha, was the oldest of 17 children. She stood on the shoulders of Letty. Now, Letty is the person who bore and raised 17 children. And these children became very well known in the community of Louisville, Mississippi, and also of Chicago, Illinois. They became first of a lot of things. My uncle Albert became the first African-American to own a cleaners in Mississippi. My Aunt Margie was the first African-American woman in Chicago to own a pet shop. My Uncle Albert was the first African-American to own a watermelon farm where he sold watermelon all over the state of Mississippi. So there was a lot of firsts in my family. Letty, with those 17 children, stood on the shoulders of Molly. Molly was my great-great-grandmother. Molly was enslaved. We showed the beautiful picture of Molly, please. Molly was enslaved and had 3 children. She had 2 boys and 1 girl. The 1 girl she had was Letty. Molly had 2 boys who she never was able to raise because she was impregnated by John Pettus. John Pettus was the mayor of Jackson, Mississippi. He also went on to become governor of Mississippi. When Molly regained her freedom, he gave her the girl, Letty, but Molly was never able to see or hear from her boys because they were of mixed race. So I am a descendant of the Pettus. Edmund Pettus was the head of the KKK in Selma, Alabama, and also served as the Grand Dragon for the KKK in the state of Alabama. So being a descendant of the Pettus is nothing that I'm proud of, because my great-great-grandmother, Molly, used to tell me the hard stories that she went through being enslaved on the Pettus plantation. So I wanted to start off with you knowing these women, because this is where I came from. I came from these women, I stand on their shoulders, and I'm happy to be a part of their legacy. Thank you so much. So I am as Eva said, I am the founder of the African American Opiate Coalition. Can we go to that slide, please? I see that we're having delays in the slides, so I don't know what's happening. So I'm gonna go ahead and do my presentation. The mission of the, all right, you wanna keep going, please? The mission of the Opiate Coalition is to influence policy that impacts African Americans in the area of AODA services that would benefit families. And it's most important that we say families, because we are so proud that we don't, that we only, not only work with people who are in recovery, but also their families, which is so important. Opiate in the Black community is on the rise. The opiate epidemic impacts the African American community at 28% Black Dane County residents died of drug overdose from 2014 to 2016. The data from 2017 to 2020 shows that African Americans are dying at a higher rate of overdose from opiates and synthetic opiates than any other population in Dane County. The Blacks' rate involved deaths and hospital encounters increased in the past decade. Although national study and data show opiate use is similar for Blacks and white people, Black men are particularly affected by opiate overdose death. They have higher rates of opiate death compared to Black women. But in the state of Wisconsin, the higher rate of death for opiate use is Native Americans. And we are not able really to get a lot of data from the tribes in the state of Wisconsin, but the death rate from opiates and alcohol is higher with Native Americans than any other population. Black men accounted for 5 and 6 overdose rates among Black Dane County residents from 2014 and 2016. Among Black men, opiate overdose rates are highest at ages 45 to 64. And for women, the highest rate is between 45 and 54, which is surprising for people that you would see people, African-American men and women dying at this age from opiate use. And I think it stems from the cocaine that Blacks were using in the 70s and the 60s and the 80s, that now they found that opiate use is especially fentanyl and heroin is a much cheaper drug to use. The opiate overdose rate among Black Dane County residents is higher than the opioid rates in Milwaukee County and Wisconsin statewide, which should surprise you. And especially when I say that the rate is higher than Milwaukee. People are always tell me, no, that can't be true, that there are more Blacks dying in Madison than there are in Milwaukee from overdose. Yeah, they are. The largest recent increase in drug overdose for Black and Hispanics were due to heroin, although there were also increases due to other opiates, and especially fentanyl. When African Americans die of overdose, it gets ignored. When whites die of drug overdose, the whole world listens, from politicians to big pharmaceuticals, from FDA and the media. When we die of overdose, it isn't news and no one listens. But let's visualize this beautiful blonde with her 2 children in her car who has overdosing on opiates. The police come, they take her and take her to the hospital, never thinking about arresting her, of course. Take her to the hospital and recommend treatment. When Blacks are found overdosing, the first thing that they do is take them to jail. So why is it that this beautiful blonde with her 2 little kids in the car can go to treatment, but this big 250-pound handsome African-American man has to go to jail? Well, we know why. Media coverage overdose really focus on young white people. It has just beginning to start focusing on African Americans. And I am proud to say, as the founder of the African American Opiate Coalition, we have brought this to the forefront in Dane County, where people are now looking at overdoses in our community and looking at it as a health risk, a health issue, when now we see less African Americans going to jail for overdosing on opiates than ever. So what are we doing in Dane County to address this issue in our community? 3 years ago, I started what I call Sunday Med Drop. And what does Sunday Med Drop mean? That I have gone so far to 10 African American churches in Dane County, where on Sunday, we will have the parishioners to come in and bring in their old and unused opiates that they have now can dispose of. What I found out that there are a lot of opiates in the medicine cabinet of older African American women. For some reason, African American women over the age of 55 refuses to use opiates for their pain. They think of addiction when they think of opiates. So they refuse to use any type of opiates. And so that has made them suffer more from pain than our white population. So what do? They put the opiates in their medicine cabinets, and that's where it's stored. And their young teenage grandchildren come in and say to them, "Grandma, do you know that we can make $25 a pill on these opiates that you have in your cabinet?" And so what the African American population have started doing is flushing the opiates down the commodes. So with the med drop that is held every 4 to 5 months at African American churches, African Americans, and we don't discriminate, you can come in, white people or Hispanics, Asian American, Native Americans, can also feel free to drop off their opiates in our boxes. Although this coalition is comprised of all African Americans, we are definitely culturally Pacific because we have not been looked at as a group that needs help when it comes to opiate addiction. I do not make any apologies for this. I've had white people that say, "Why can't I be a member of this coalition?" Well, because when I founded this coalition, I wanted it to be just for African Americans and has been very successful. We have doctors, we have lawyers, we have people from the public defender's office, we have people from the DA, we have clinicians, we have mental health case managers, you name it. We have every population of folks that are now a member of the African American Opiate Coalition. We also are members of different organizations in the community, starting off with the African American Health Network. We're a member of the Urban League. We have done presentations all over Madison, Dane County. As you're looking at now are some of the places that we've visited, and especially the churches. And as you can see, I'm with people from the Sheriff's Office and also from the Madison Police Department. I am not allowed to collect the medicines. Only the police and the sheriff can collect the opiates medications in our community. And with the medication, they take it and they dispose of it for us. Last year, Madison had the distinction of being #1 in the country when it came to disposable of opiates in our community. Now, that is nothing that we're proud of, but then again, it is something that I'm very proud of, that we collected the state of California, of all places. California came in second behind us when it came to collections of opiates in the community. of the African American Opiate Coalition. I am so happy to say that we are making a difference in this community, and we continue to do this. And I'd like to give a plug that our next med drop will be April 24th, 10 to 1, and we will be collecting medicine at Mount Zion Church, Elva Park, and Warner Park on April 24th from 10 to 1. It has been my honor and my privilege to speak to you today, not only as a woman, but as a woman of color who is out here fighting for my population to combat this plague of opiate in my community. Thank you so much.
Thank you so much, Ms. Charlie. What an incredible testimony. And thank you for all the work that you do. As a pharmacist, I can say that this is a tremendous effort. And we've learned over the years that many of the challenges that communities face cannot be addressed in the healthcare system. So this community-based effort to curb the illicit use of opiates and to collect these unused drugs and to partner with the Sheriff's Department is just absolutely incredible. And it had very dramatic impact in our state. So I thank you, and I thank everyone that is working in collaboration with you on this effort. Our next speaker is Gail Johnson. And Gail Johnson, when I think of Gail Johnson, the only word that comes to mind, well, it's not the only word, but the first word that comes to mind is supporter. And that's because Gail Johnson has supported many healthcare professionals, which includes myself, as well as community leaders and community organizations. And she's really committed to helping us in our efforts to improve the quality of care for African Americans in our community. Now, Gail Johnson is the director of the Wisconsin Well Woman Program, and she has held that position for over 20 years. And in that role, she's been involved with the National Breast and Cervical Cancer Early Detection Program that's administered by the Center of Disease Control. So this group has been actively engaged in helping women who do not have health insurance that are diagnosed with breast cancer. She's also been a member of the Wisconsin Women of Color Network. And she is an original member of the African American Health Network, and she's going to provide you with some information about the history of the network. So I'd like to present Gail Johnson.
Good afternoon. Good afternoon. And thank you, Dr. Vivian. And for those of you who are wondering, I did not pay Dr. Vivian for those wonderful remarks. I think that's the first time in my life I've been called incredible, and I will take it. Again, good afternoon to all of you. And I'm going to also say that I'm going to follow Ms. Charlestine's history theme just a little bit. And you all should know that everyone in the community calls her Miss Charlie, but me. I call her Miss Charlestine because I love her name. And speaking of history, Miss Charlie, or Miss Charlestine to me, shared with me how she got her name. And I've always told her that I love her name. So first of all, let me say that as Dr. Vivian said, I have been with the African American Health Network for since its inception in 2003. As a matter of fact, it was the director, if you will, it was the minority health officer in 2003 who talked with me and some other folks and said, you know what, we need an organization that's really going to focus on the community. So you've heard Dr. Vivian talk about, our focus on health education, our focus on healthy lifestyles, our focus on well-being among African Americans in Dane County. And so we really, really, really embrace those things. I enjoy being a part of the African American Health Network because, quite frankly, I like working with the community. So would you start my slides, please? Okay. As I said, I've been a part of the network since its inception. And so when I looked at the theme today, resistance and reimagination in the health of African Americans, I thought about a lot of the things that we've done with the network. So I'm going to talk about a few things we've done with the network, and then I'm going to talk about a few other things. Next slide. Okay, for some reason, I can't advance the slides.
Gail, I'm going to fix it. For some reason, there's a little bit of a gap. Pardon me. I'm going to find that second slide.
Okay. So I will talk a little bit while we're waiting for the slides to advance. As it has sort of turned out, the African American Health Network is a small organization, but I like to think that we are mighty. And I'll tell you why. You see here, health is our greatest wealth. Well, let me tell you where that came from. Again, with the African American Health Network, we were sitting down one day. We were planning a health education program. And we started talking about themes, and we started talking about, the things that are important to the African American community. And of course, we all agreed that one of the things that's very important to us is that we want to be a healthy community. When I think about us, I think about wanting African American women and their families to live long, strong, healthy lives. And as one of my program partners says all the time, it all begins with a healthy woman. And as you know, as you've heard from Dr. Vivian, I do work in women's health, and I'll talk about that in a minute. But one of the things that I wanted to do in terms of talking about health as our greatest wealth and the impact of good health on the family is just to share with you just some photos of African American families, African American children. We have, a single African American woman, an African American couple. What we want for them and for all of the rest of us is to live those long, strong, healthy lives. And so that's one of the reasons that I do what I do in the community, and I do what I do professionally. Next slide, please. So I'll talk about the venues and some of the activities that both the African American Health Network has been involved in, and then some of the other things that I've been involved in terms of working with the community. Okay, so the first thing is, I have been involved in situations where I have had the good fortune of working, obviously, with the network to plan programs. I've also had the good fortune to have other folks come to me because they've seen me with other people putting on programs and say, hey, could you come and talk with us? I've also had the good fortune of seeing folks like Ms. Charlestine and saying, would you come and put on a program? And so let me talk about that for a minute, because I believe in 2019, pre-COVID it was, I asked Miss Charlestine to come to the health department to give her talk on opioids in the African-American community. And needless to say, she blew everyone away. There were a lot of questions after she finished the formal presentation. But the other thing that was so important to us was that after everything was over, during the latter part of the day and the next day and a couple of days later, I got all kinds of messages, primarily emails from folks who said, wow, you know, I didn't know that. I didn't know about opioids in the African American community. I didn't know that it was such an issue. I didn't know that there were those kinds of challenges. So she really opened up a lot of eyes, and I might add ears. Next slide, please. So one of the other things that I've been able to do is, again, to be a part of different venues when it comes to health education. And as I said, sometimes I present, other times I put the education session together, and sometimes I'm there as a learner. I have learned a lot. So let me tell you about some of the venues that I've been a part of. Breakfast gatherings, gatherings with community centers. When I think about the African American Health Network and I think about some of our history, I remember that a couple of times we went to community centers that are part of housing developments, and we just had small programs in the community center, and we invited the residents to come and meet us, talk with us, and learn a little something. I've worked with a lot of community-based organizations. I've worked with tons of faith-based programs. A couple of things about faith-based programs, especially in the African-American community, and Ms. Charlie has sort of laid the groundwork for this. In our community, you know, many African-American faith-based organizations, churches, have health ministries. And having health ministries, I've gotten calls from different folks who've said to me, you know, we're having a program on this day. Can you come? And then I have to tell you this story. I've gotten calls from folks who've said, we're having a program on this day, and we need a speaker, and we need this, and we need that. And one of the things that always delights me is that I have people like Dr. Vivian, Ms. Charlestine, and others that I can call on and say, you know what, I've gotten a call from such and such a church or such and such a organization, and they need someone to speak on diabetes, or they need someone to speak on opioids. Are you available on that day? So I've done a lot of that. I've also, because I'm in women's health, I've done a lot of programs on women's health. So I've spoken with a lot of women's groups. Last fall, for the very first time, I participated in a drive-by health fair, and Ms. Fabu will probably talk about that in a minute. I'm going to talk about the Breakfast with George Foreman in just a minute. With the African American Health Network, we've done programs at the Urban League. I had the honor of doing a program a number of years ago with women, African American women, who were formerly incarcerated. And I'm going to tell you how this came about. Someone that I knew came to me and said someone else had a group where they were working with women who had been formerly incarcerated. And they said, will you come and do a program? I said, yes, yeah, not a problem. And I went, it was sort of a lunchtime program. I think I went like at 12 noon, and we finished up probably shortly after 1 o'clock. It was absolutely wonderful. And keep in mind, when I do these things, when I do these programs, I learn, whether I'm one of the presenters or I put the program together, I always learn something. One of the other things that I want to just highlight for a moment is, again, another program that we put on with the African American Health Network. So again, I'm in women's health, and you know, around 2009, 2010, the big thing was the HPV vaccine. And at that particular time, the research was saying you need to start vaccinating young people, probably at around age 9, so 9, 10, and 11. Well, as you can imagine, that's not necessarily something that parents want to hear all the time, okay? Because the first thing at that particular time that came to everyone's mind was, okay, well, wait a minute. My child is 9, 10, or 11. My child is not sexually active. What we were supposed to be doing was saying, we want your child to get this vaccination because in the future, we want as much as possible to prevent your child from having cervical cancer or other cancers. So we put our heads together with the African American Health Network, and we said, you know what? We know in our community, our parents have the same concerns. No one wants to think about their child being sexually active at 9, 10, 11, or 12. So as we talked, we said, but you know what? Folks in the community are really interested in Alzheimer's. They're very interested in Alzheimer's. So why don't we do this? Why don't we put together a program where we talk about cervical cancer and the HPV vaccine in the morning, and then we talk about Alzheimer's. And you know what? We had the program, and Dr. Vivian, please correct me if I'm wrong, but I don't think we got any pushback. I don't think we got any complaints. We brought in an African-American physician that works with me a lot. I asked her to come to talk about the HPV vaccine. Folks had questions. She was able to respond to their questions. And that's one of the wonderful things about working with the community. You give folks an opportunity to ask questions, to share their concerns. You know, when I hear people talk about the mistrust in the African-American community surrounding research and healthcare and all of these kinds of things, one of the first things I say is, because I say, did you give these individuals the opportunity to sit down with you and to ask questions and to share their concerns? Did you have a person that was knowledgeable and was well respected from the community who was there to respond to their questions and to help allay their fears? So that's what that's one of the big things we've been able to do with the African American Health Network. Next slide, please. Okay, so sort of like Miss Charlestine, I'm a little bit of a historian. I'm not, as good as she is, but I'm also a little bit of a storyteller. And so what you see here, first of all, you see a photo of George Foreman, and I'll talk about that in a minute, but you see a book on having to do with African-American literature. And then you see a book, the cover of a book, A Minute for Your Health. And I'm going to tell you why I have this slide. One of the other things that when we get the opportunity that I try to do when I'm doing a presentation is to give information that I think that folks will be valuable, that they can take home. So this book, A Minute for Your Health, this book is now well over 20 years old. It was written by the Association for Black Cardiologists. And the primary author is a Black physician that I actually knew. I haven't seen her in years, but she was one of the primary authors for this particular book. And in this book, they talk about children should know their grandparents and hopefully their great-grandparents. And it gives all kinds of helpful tips that are really culturally appropriate for our community. So what we used to do was to give copies of this book to our health education participants. I've used it on many different occasions. As I said, the book is well over 20 years old now. I was also fortunate enough for one program that we put together, I was fortunate enough to have the author, the primary author, come to talk about the book and to give a presentation. Now, you're saying to yourself, why does she have that photo of George Foreman, you know, as part of her presentation? Well, I'm going to tell you. We all know about the George Foreman grills. So this was many years ago. The Fatherhood Initiative in Milwaukee was going to bring George Foreman to Milwaukee to work with young fathers. Someone connected me with the folks who were going to do this. I met with them and I said, that sounds real interesting. So I came up with this idea of breakfast with George Foreman. Keep in mind, it was in October, and as we all know, October is Breast Health Awareness Month. And of course, for me, that's a very busy month. So I said, okay, let's have breakfast with George Foreman. And the reason I said breakfast with George Foreman is because the Fatherhood Initiative, that organization had already scheduled him to speak to the fathers, to speak to men that afternoon. Well, everybody said yes. So we had a program in Milwaukee with one of our Milwaukee partners. And again, it was breakfast with George Foreman. So a couple of things happened and they were all great. First of all, community people showed up. Some of the people who showed up were supposed to be in class, but they let me know, I couldn't miss this. So I'm here for this. Others were supposed to be working. And again, they said, well, I couldn't miss this. So I thought I'd, take off a couple of hours to come and hear and meet George Foreman. First of all, George Foreman was as gracious as he could absolutely be. He was absolutely wonderful. And we talk about families. He told the story of his sons who are named George and why he named them George. He talked about his wife. He talked about what he decided to do after he finished boxing. And that's how the George Foreman grills came to be. So guess what else we did? We had a presentation on cancer from one of the cancer experts that I work with a lot in the community. So she answered all of the questions that folks had on cancer. And then what we did was we were able to give away George Foreman grills. Okay, so needless to say, it was a very, very popular program. The other thing that happened was that everybody got a chance to take individual photographs with George Foreman. Again, he was very gracious. And this was important because everyone was having a good time, but they learned a lot as well. And so that's one of the things that, when I tell people about that breakfast with George Foreman, I have to laugh myself. And as I said, he was a very gracious gentleman. When he first came in, I said, well, Mr. Foreman, where would you like to sit? And he said, Miss Johnson, wherever you want me to sit. I said, okay, all right. And again, he was one of the highlights of my career and of my life, meeting him. So I've talked about George Foreman and I've talked about A Minute for Your Health. And as Dr. Vivian has said, I have been the director of the Wisconsin Well Woman Program for more than 20 years. Next slide, please. And the Wisconsin Well Woman Program is, as Dr. Vivian indicated, part of CDC's National Breast and Cervical Cancer Early Detection Program. So now a couple of things about the program. First of all, the program has been in existence since 1990. Here in Wisconsin, it's been in existence since 1994. And I want to let you know that in the years that we've had the program, we have been able to provide breast and cervical cancer screening services to more than 82,000 Wisconsin women. Next slide, please. And even though you might not be able to see this slide clearly, let me say that if you go to our website, what you're going to see is the history of the program, the covered services, who's eligible. Let me share with you that the program is available in all 72 counties in Wisconsin. We also work with the 11 tribal nations, and we have tons and tons of program partners. And that's important because these are the folks who help us get the word out about the program. If you are uninsured and your income is below 250% of the federal poverty guidelines, you may be eligible for the Wisconsin Well Woman Program. In closing, I want to just go back to our theme. Next slide, please. Go back to our theme, resistance and reimagination in the health of African Americans. The reason that the theme is important to us, to me, is it makes me remember to honor our ancestors, those who came and endured before us, those who are known as well as those who are unknown. And I love to brag about this, speaking of women living long, healthy lives. And quite frankly, we want all of our folks to live long, healthy lives. I am the great niece of Ms. Hattie Day. Ms. Hattie Day has been deceased now for about 6 years, but Ms. Hattie Day lived to be 102 years old. She was my father's aunt. She went to sleep on her 102nd birthday and didn't wake up. So I always remember that. Also, my Aunt Mag had 10 children, and she lived to be 101 years old. So I am very, very, very proud of that history. And I think about it and I say, yes, women living long, strong, healthy lives. The other reason that resistance and reimagination is important is because it helps us to encourage creativity. Think about some of the things that our folks had to endure, but think about what they did to make a way for us. Think about some of the things that came about because folks had a challenge and they said, okay, I need to respond to this challenge. What am I gonna do? So it's important that we encourage creativity. And last but not least, we have to nurture the next generation. In addition to working with the community, which I love, the next best thing for me is working with students. And Ms. Charlestine and Dr. Vivian and others who are with the network have heard me talk about bringing young people along. I have had high school students work with me. I have had students work with me who now have their PhDs. I had a student who worked with me for 2 summers a couple of years ago. She went on to get her master's degree in public health. She contacted me and said, now I'm applying for medical school. She is a young African-American woman. She wants to be in women's health. I said, you just let me know how I can help you. And let me tell you what I do with my students. And the medical student, the one who's applying for medical school, this is what I told her when she first told me what she wanted to do with her life. I said, okay, listen, when I get to the point where I don't have any food, you know, and I don't have a car. I said, now, don't pretend that you don't know me. You know, buy me a bag of groceries and give me a ride to wherever I need to go.
Wow.
Thank you so much and stay well. And I've loved talking with you.
All right. Thank you so much, Gail, for sharing those experiences. Now we're right at 5 o'clock, but I'd like to give our wonderful poet, Fabu Carter, an opportunity to share her poetry. Now, it is available online, but it's very rare that you get to hear such a resilient, multi-talented woman's poetry that transcends the globe. Fabu Carter, who is known as Fabu, was appointed Madison's Poet Laureate in 2008, and she maintained that role for 3 years. She is currently a senior outreach specialist with the Wisconsin Alzheimer's Diseases Research Center and works with African American and Native American communities. I'd like to give a shout out to Fabu because she recently obtained her PhD in African American Women's Studies from the University of Nairobi. So this is just incredible. I'm so proud to know this woman, and now she's going to share her poetry with us.
So thank you, Dr. Eva, and I'm very happy to be a part of this conference and a part of this panel. I think everyone can hear how the African American Health Network is an opportunity for all of us to offer services to our community, but also to be a part of keeping our community healthy. So as Dr. Eva Vivian said, this poetry is available for people to read on their own. And so in the interest of time, I won't read every poem, but I'll certainly read about 15 minutes worth so that we can have the opportunity for questions for all of the panelists. So I'd like to thank my two colleagues, Ms. Charlie and Gail Johnson, for their presentations because they were very moving to me. And I just so love looking at the history and hearing the history of African-American people in Wisconsin and in the world. So what I'm doing with this poetry, we all know about the health disparities that affect the African-American community. Only now are scientists beginning to talk about how, you know, how the racism, both personal and systematic, affects our health and our lifespan. And so this is an opportunity through poetry to take all that you've heard and to shrink it down into poems. So I'm starting off in a kind of a chronology, and the first poem is called Dismerica. Dismerica, because I was trying to imagine as a poet, this is National Poetry Month, what did the people feel when they were on the ships being brought here? Not the first time that the African explorers came free, but the second time when African Americans came in chains. Dismerica. One day we be in village, living and free, living and free. Next then come buckra slavers, carrying death in long, shiny chains. Souls began dying from first chains, pon we necks, arms, feet. We cry out for help in many, many tongues. Buckra starves and beats we walks, till feet be bleeding. Walks, we walks, to where we not know. On ship, we rot and stink below. Men's, women's, children's, mamas with belly full of child, all hate every rockin' that take us far from home. Selling block, we know, remember, small pain, again the trip across the ocean. We people piled high in water graves. Massa stars and beats we works, till hands be bleeding. We works, for why we not know. Already hearts is dying from first chain feet. Step upon this land, this America. So I'd like to say that health disparities started with those first chained feet that took us away from home and family and life as we tried to rebuild during the slave period in America. I came upon one of the earliest records of African Americans in Wisconsin from a 1725 speech by a chief of the Illinois Indian. In this speech, he reported that their enemies, the Fox, had killed 2 Frenchmen and a Negro belonging to Monsieur de Barbette in Green Bay. In this recorded account, Negro is not capitalized, but the Frenchman's name is, indicating that even then, this African American was deemed unworthy of a name to be included or race to be respected in the state historical record. Earliest written record of an unknown Negro in Wisconsin. In 1725, Green Bay, Wisconsin, an unknown Negro, though familiar to other Negroes, was killed. In 1725, Green Bay, Wisconsin, an unnamed Negro, according to an Illinois chief, had 2 enemies, French and Fox. In 1725, Green Bay, Wisconsin, an unarmed Negro, believed to be enslaved, fell pierced by arrows. In 1725, Green Bay, Wisconsin, an unloved Negro, except by God, died too far from Africa. Now this next one is a very hard poem to read, but it was even a harder poem to write. But it is the personal stories of so many African-American women. So when I returned from Kenya as a grad student, and I was down south, and I just started listening to people's stories. And almost every family in the South, there were stories of lynchings and stories of rape. A trilogy of rape. Part 1, slavery, the rape of little sister. Round, baby fat rump, slightly tilting toward the sky. Little sister was out back, kind of squat down, TT. Long came massa rounding the corner, should have turned back, 'cause sister's butt was still in the air. Instead, he waited patiently till she finished shaking herself dry. Then he dropped his pants and eased up on her. Lay down, little sis. Lay down and let me in. Don't matter that you're 10. Don't matter that you're kin. Part 2, Reconstruction, the rape of little sister's daughter. Mr. Mott came by last night, told Big Buck he had 3-day work for him, 3-day work turning over land at the old Lee plantation. Mr. Mott came by the next night, throwed Big Buck's wife down on her mama's red quilt pallet, abused Imogene for hours, right there in front of her screaming babies. Mr. Mott came by another night. Buck came back early too. Old Mr. Mott is dead. They lynched Buck, put his manhood in a mason jar to save the South. Part 3, Post-Reconstruction, the rape of little sister's granddaughter. Sadie struggled the Black way, hard and long, to go to school. Education will take you far in this here world, her ma say. First one in the family to get much learning. Sadie teach colored at the normal school. Lord, how she make us proud, her grandma say. Ah, Sadie, with her clever mind and amber eyes, we live to see our folk rising from the slave fields to the schoolhouses. The principal, a Boston carpetbagger, kept her late one evening. He had his way with that poor child on the schoolroom floor. Raped grandma, raped ma, raped grandchild. Sadie say they relieve themselves in us. We just like the outhouse to be shit in. So when you look at those collective and individual experiences, how does that affect the quality of your life, the length of your life? And yet, on the other hand, we think about the resilience of African American people, the hope and the joy that has kept us alive all of these years. Arriving free in the Green Land. So I've read about the 2 Black settlements that existed in Wisconsin. And I also read about the Black people in Wisconsin who purchased the freedom of their family members down south and then came to the Midwest. Arriving free in the Green Land. When we came walking, feet sore, covered in slavery dust, master's whip and lash still throbbing hot across our scars, troubling our minds, dimming our hopes, we saw the green land and sighed. Wagons carrying our sick, full of moaning darkness, aged littles, mamas with suckling babes, escaped or freshly purchased, only this time purchased for family by family. All of us looking for newness. We wondered where the red ones had gone. Remains of native peoples forced away from these abundant waters and stretched out lands still call Ho-Chunk names. Cousins passed, paused, then traveled on up to Canada, not trusting freedom within US borders. We distrusted too, but cracking bones begged for rest. We fought snow and ice, thinking long about our family, fighting snow and ice further north. Languages spun like spinning wheels around our ears from other poor white immigrants desperate for farmland and freedom. We didn't hear the dreaded cracker voice, so we settled the green land. Whether we look back south or forward north, we had to anchor ourselves in the present, praying for a Midwest welcome, that our color be hidden inside hearts willing to accept we are people too. I actually think I'll be able to finish, and we still will have time for questions and answers. Another way that African Americans are dying, I had a cousin I didn't know very well. I knew her father. We grew up, but he was my younger cousin. But I found out that I had a cousin at 13 in the summer of 2020 to be killed in a drive-by in Chicago. All she was doing was inside watching TV. Someone passed by in a car shooting, and she was shot in the head. Lament for Yaya, killed by a drive-by shooting, Chicago 2020. Smiling on Facebook, I didn't know you, but I love you. Tiny teenage girl, I didn't know you, but I was you. In the family tangle, I didn't know you, but I claim you. Your dad, a cousin, I didn't know you, but your family too. He died early in Florida. I didn't know you, but I miss you. You died in Chicago. I didn't know you, but I grieve you. As you watch TV, I didn't know you, but a bullet took you. 13 years young, I didn't know you, but I won't forget you. And I wrote that poem for her because still the people who shot her have not been found. And since then, so many more children have died in the Chicago streets from drive-by shootings, innocent babies, as early as babies. And I'm going to end this with a reading for our elders. So in the Black Lives Matter movement, it used to be, of course, in the earlier protests, that generation that was on the front line can no longer be the generation that's still on that front line due to COVID and due to age, et cetera, et cetera. So I wrote this poem in their honor of the conversations, An Elder's Lament During COVID. Protest this time without my body. Surely my heart goes with you. Over 60, I am the victim of racism turned into health disparities. My mind supports you without my weakening body, but with the fist of my words. Over 60, COVID kills me first, and wisdom must remain to speak. As an elder, I'll work to dismantle unjust systems, political and otherwise. As you take to the streets without my body, carry me and our ancestors with you. Thank you.
Fabu, Dr. Fabu Carter, thank you so much. You are so talented and your work just touches my heart. The last poem made me think of my uncle, the late Reverend C.T. Vivian, who was on the front line during the Civil Rights Movement. And I think one of his last moments was being able to watch people protest in peace after the death of George Floyd. Mm-hmm. And that was actually progress, because during his time, African Americans, then referred to as Negroes, were arrested even if they attempted to protest peacefully. So while our progress has been slow, we are making steady progress. And as Angela Davis said, freedom is a constant fight. So we have to be vigilant and we have to continue to fight. There are moments where it seems like things are comfortable, but we can't ever get too comfortable. If we remember, we were so proud when Barack Obama was elected president of the United States. And there were some that made the mistake of assuming that racism was eliminated. Racism was still very much alive. So even when we take a step forward, we have to remember that we have to continue carrying the torch. Thank you so much. Now, I'm sure that all of you understand why it's such an honor for me to work with these women. And this is my favorite part of my job, is having an opportunity to work with the community. So now we'll entertain any questions that you may have. And I don't know if they want me to read the questions in the chat, or Lori, if you're going to read the questions. How will we do this?
As you prefer, Eva. I'm happy to read them, and people can put questions or comments in the Q&A and the chat. And thanks to everyone, as I wrote in the note, there was just so much wisdom and strength and truth-telling at this table that we are really honored, and we will look forward to continuing to amplify your work and voices. So let's have some conversation from the participants. And also, if you want to just have some dialogue with each other, that would be very welcome also.
Here is a question for Fabu in the chat. Fantastic, Fabu, powerful. To write, do you isolate yourself? How many drafts do you have to do to make your poem? Thank you.
So poetry is an interesting thing. So I have written some poems. I wrote them once and they were done. That's certainly not true for most of them. So I do read several drafts until I feel satisfied with the poem. I have a poem called The Mary Turner Lynching, and it's based on that lynching in Valdosta, Georgia. I literally worked on that poem for 10 years before it was done. So I think actually the answer is that a poem tells you when it's finished and ready to go out into the world.
Mm-hmm. Dr. Vivian, I've always said to Fabu that she needs to be like, you remember this, Fabu, when I told you? You need to be like Virginia Woolf and Alice Walker. You need a room of your own. You need to not have a job to support yourself, but you need to be able to go to a room and write your poetry for at least 3 to 5 years and publish them all. And I wish there was some way that we could have a grant, or there's somebody that would sponsor you for at least 3 years where you could just have a room of your own and go and just write. I've always hoped that for you.
Thank you for saying that again, Miss Charlie, because I remember feeling so encouraged and inspired when you told me that. And really, when I saw the pictures of the women in your family, I mean, I felt inspired about a poem. I could see such strength and beauty. So I would love to do that, because to try and capture the story of African Americans is such an honor, but it's also, it's both heartbreaking and joyous. It's everything we feel. And there's so many wonderful stories to tell. But thank you for sharing those photos of your family and the fact that you have such legacy. it's like I get to share in that too.
Okay. Martha Taylor asked if Gail has a sample presentation that she could share. She states, as a white woman, I think I need her advice for a healthier life.
Wow. I'm going to be very honest with you. Many times, you know, I talk so much. Many times I just sort of go with the participants. I do have a couple somewhere, you know, and even the ones that I have that are written, I really and truly just sort of improvise a lot when I'm talking. So, you know, if I can help you at all, you know, contact me. Yes, go to our website, the Wisconsin Well Woman Program, and you will see my information on there. Yeah, just email me. I will help you all that I can.
Wonderful. Also, Martha Taylor had a question that she would be really interested in Miss Charlie's career and what personal experience influenced her to pursue her important work. Miss Charlie's introduction of her foundation was wonderful, illustrating how our work is built on the shoulders of others. Thank you, Miss Charlie.
Well, thank you for that question. I think my grandmother was the most influential person in my life. I went to live with her when I was 11 years old after my mom died. And she instilled in me that there was nothing that I couldn't do and want to be in life in the 50s as a Negro little girl. I think, you know, I often say that my mother died so that I could live. And I going to live with my grandmother, I must say, was one of the best things that ever happened to me. I lived in Chicago, as I said, and that was a culture shock to be in the slave state of Mississippi after coming out of Chicago. But one thing she said to me from the time that I went to live with her, "You going to college?" She always said that I was going to go to college. And that was my thing. She said to me, "I don't want you to," it's a shame because I don't know how to cook and clean. I know how to clean, but I don't know how to cook today. Thank God I married a man who knew how to cook. But she said to me, "You will never cook or clean in a white person's house. I don't want you to learn how to cook. I don't want you to learn how to clean. I want you to go in there and I want you to read." And so that's what I did. Well, she didn't know I was reading a lot of the True Confession romance magazines either. But she thought I was reading Chaucer and Shakespeare. But I was also reading True Romance magazines. You guys are too young to even know what those magazines were all about. And but my grandmother, go ahead.
No, go ahead. I'd just like to comment that what Miss Charlie learned from her grandmother, she actually passed down to her granddaughter. Her granddaughter is very successful. Her granddaughter, Copper, was accepted into 9 colleges. And Miss Charlie has always instilled in her granddaughter that she could be and do anything she wanted to do. And my dissertation work centered around factors that influence the resilience of our youth. And all too often, our youth only get negative messages from people within our society. So it's very important that they hear from someone really close within their circle, a parent, and many times it's a grandparent that tells them that the stories and the stereotypes about them are not real. So we have to resist the stereotypes or the negative images that society has established for us and actually reimagine ourselves as being beautiful, talented, and successful. And it's important that we instill that in our children. And Miss Charlie is a perfect example of someone that has done that.
And that's why I think this panel is so important and speaks to the theme of the conference this year, because we have successfully used art in our community to reimagine and to tell the true stories of who we are. So when our history isn't being taught in the school, our accurate history, when children still think their slavery is the beginning of themselves in this country, they don't know about the African explorers, they don't know about people who came here free, but still we can use art to show them really who they truly are and not who anyone says they are. So art is a very powerful tool that is used to extend the lives, to improve the quality of life, and to, you know, combat systematic health inequalities that exist. And so the African American Health Network, even just by joining us all together, for me, gives me resilience, hope, laughter. I love being around the other women, listening to them, hearing their stories, sharing with them, and working on a common goal to help our community. It's an honor and it's a privilege.
Well, Fabu and Eva, it takes a village to raise a child.
Yeah. Mm-hmm.
Fabu and Eva, I'm sorry, Gail, that my granddaughter don't know you. My granddaughter loves Fabu and Eva. From the time you came to her elementary school, Fabu, and read your poetry, you have been someone that my granddaughter admired. And Eva, she loves you. You are her mentor. So it takes and Gail, you might as well get on that bandwagon.
Come in when she becomes an adult and help her on, Gail.
Now, you know, Miss Charlestine, even though Copper doesn't know me like she does Dr. Vivian and Fabu. Now, I have seen her a few times over the years, here and there. So just so you remember that. And let me say this. I'm going to go out on a limb and say, I hope she has some interest anyway in women's health. You know, I'm always pushing that. Okay. So just a thought.
Okay. Gotcha.
Okay. There's one last question and I don't know if we'll have time. It looks like we might have 30 seconds. Thank you, Dr. Vivian, Miss Charlie, Miss Gail, and Dr. Fabu. Your work inspires and is impactful in our community. What is the one thing you would tell those of us following in your footsteps when we run into obstacles and challenges?
That you have a network like we do so that we can lift up each other and support each other.
You know, we have this wonderful ability as African Americans to create family. And I think we had to learn it when we were separated as family.
Yes.
So we come to new places and we form friendships that are as dear to us as family and people who are as important to us as biological family. Find your family wherever you go.
So we're at 5:30 now, so we want to be mindful of the other events that follow. Once again, Lori, thank you so much for inviting us to be a part of the 4W conference. We really embrace the opportunity to share the talents associated with our network and hope that everyone listening really enjoyed the stories and the presentations.